October is Breast Cancer Awareness Month, and today on Mile High Mornings, we want to honor the warriors who have gone through or are currently going through that fight. We need your help, though, to do that. This morning, we'd like you to send a shout out to a breast cancer warrior in your life. Send us a picture and tell us a little bit about their story. Use the hashtag Mile High Mornings on social media, or grab your phone and text us the photo and story at 303-871-1491. We are going to share some of your shout outs throughout the newscast. But first, we want to share some facts, starting with the most significant risk factor of getting breast cancer: being a woman. Another significant risk factor is simply getting older. True, men get breast cancer too, but a man's lifetime risk of developing the disease is about 1 in 833. For women, about 1 in 8 of those in the United States will be diagnosed with invasive breast cancer at some point in her lifetime. This year, according to breastcancer.org, an estimated 281,550 new cases are expected to be diagnosed. That's along with another 49,290 cases of non-invasive breast cancer. Women with the family history are far more likely to develop the disease. Their risk is actually doubled if their mom, sister, or daughter develop breast cancer. But the fact is, 85% of breast cancers occur in women with absolutely no family history of the disease. Those cancers occur because of genetic mutations that come from getting older and from life in general. Remember, the greatest risk factors for breast cancer are growing older and simply being a woman. For women in the U.S., death rates for breast cancer are higher than those for any other cancer besides lung cancer. As with any cancer, early detection is key to survival, which brings us to mammograms and recommendations for screenings.
I think the average risk woman should, at 40 years, talk to her doctor about whether she should start mammogram screening. Most of 40-year-old women should probably start it. It's also really important to do self-breast exams because you yourself know your breast better than anyone else, and you can tell if there's a change. And then once a year, you probably have to have a clinical breast exam, meaning a healthcare provider, your doctor, your nurse practitioner, whoever should also check your breast.
Dr. Coley says women at higher risk should think about starting those screenings before the age of 40. You can watch my full interview with Dr. Coley on 9news.com. So earlier, we asked you to send a shout out to a breast cancer warrior in your life using the hashtag Mile High Mornings on social media or texting us. That number's on your screen, 303-871-1491. We got so many wonderful pictures this morning, including Andrew sent us a picture of him and his mom in the hospital. He says, "She is the strongest woman I know." And Maureen sent us a picture of herself wrapped up in her Broncos blanket. She told us this photo is from October 2019, the day she received her first chemo treatment. Best of luck to her and a fast and healthy recovery. But like Dr. Coley said, early detection is key in prevention. 85% of these cases are no family history, genetics. And so, yeah, you got to know your body and pay attention.
Yeah. So many people missed those appointments in the last, 2 years because of the pandemic and everything else. And it's just not a good idea to do that. You should go in, you should get checked out. If you notice something is off, it's best to get it checked out and just have peace of mind, because it is the early detection factor. We say that all the time.
Absolutely. Can't stress that enough. And that early detection has come down. I mean, it used to, I remember when it was 50 years and then it was 45 and now they're saying 40. And if you have a family history, even younger than that sometimes. So yeah, pay attention to all of that.